One of the most devastating of all brain disorders are those that result in memory loss, such as Alzheimer's disease. Emory and its community are extremely fortunate to have a team of people, scientists and clinician scientists, who are at the cutting edge of developing not only treatments, but potentially preventive measures for Alzheimer's disease. Our first speaker tonight that will share with you some of his work is James Law, who is the Alice and Roy Richards Chair in Neurology and the Vice Chair of that department. And he is going to share with you tonight some of our evolving understanding of Alzheimer's disease pathophysiology and some of the strategies he and his colleagues are using to not only treat this, but perhaps prevent it. Jim?
We don't have a lot of time to talk about very complex disorders and conditions that we all manage and study, but I want to give you a flavor of where things are in the area of Alzheimer's disease and what the current prospects are and what I think the really optimistic view of the future is. And I've told this story many times, but nearly 20 years ago when I was a very young faculty member a new faculty member here at Emory, one of our social workers who runs support groups for many of our patients and their families related a story to me where two women were talking to each other, and they both happened to be spouses of my patients, and one of them turned to the other one and said, you know, Dr. Law says that there's going to be a cure for Alzheimer's disease before he retires. And the other lady looked at her and said, yeah, don't you wish he was older? And actually, nearly 20 years ago, when I was telling people that, a lot of people thought I was crazy. But I'm not crazy, and I can tell you that I expect to see a cure for Alzheimer's disease before my career is over. And let me first of all tell you what a cure is going to look like. When you hear the term Alzheimer's disease, it strikes terror into our hearts because you picture a debilitated individual who can't remember things, who can't appreciate the interactions with their families and loved ones and friends, have lost the essence of what made them who they were. And that's a horrifying picture. But I can tell you that the way that we approach Alzheimer's disease diagnosis now is it's in a very different place. The majority of people that I take care of in my clinic, until the very end, until the last couple of years, you would meet them casually and not suspect that they had Alzheimer's disease. So the goal is this. Alzheimer's disease is a disease that hits us as we age. It's by far most common in people in their 70s and 80s. And although Dan has said we have a continued growth in longevity in this country, there is a theoretical limit of about 125 years of life expectancy. And so the goal is for us to extend our health span to that point. And in terms of Alzheimer's disease, what we want to do is delay the start of Alzheimer's disease or slow the progression so that your memory doesn't have to be perfect. Mine's already not perfect. And if your memory is declining a little bit, but you still have the wherewithal to enjoy an excellent quality of life, enjoy interactions with your grandchildren, your friends, and your family, and then you drop dead of a heart attack, great. We win. The cardiologist loses. The muscle is there primarily to pump blood to the brain, so it's all's well. So that's what it's going to look like. And the way that we're getting there is this, and we're on the cusp of this right now. What we need to do is we need to delay the development and progression of disease. What we appreciate now that we didn't appreciate 20 years ago is that Alzheimer's disease is no different from any other chronic disease. The disease doesn't start when you start losing your memory or getting lost. I already get lost, but it doesn't start when you start having symptoms of memory loss or other decline. That disease is progressing as pathology in the brain for 20 or 30 years before those symptoms start. And so what we need to do is we need to identify the disease at its earliest stages, hit it in its earliest stages, and really make an impact on those things that are actually driving the disease. And we're doing that right now. Within the next couple, 3-4 years, I expect that there will be an FDA-approved drug that has proven its ability to slow progression of Alzheimer's disease. The problem is we still have a couple of major challenges. We know, for instance, that the targets that we're hitting right now, if we wait until somebody is already moderately demented, it doesn't work. The drug does what we expected it to do in the brain, but it does not stop or slow the progression of disease. So our current challenge is this. As we develop these treatments that can actually alter the trajectory of the disease, delay its onset and slow its progression, we need to be able to identify the disease in its nascent stages, kind of like, you get your 50th birthday present and you go schedule a colonoscopy. Sort of the same thing, except you screen for Alzheimer's disease, and if it looks like you're at risk, tell you what, you take on some risk in terms of treatment for something that may delay the progression or onset of disease by 10 or 20 or 30 years. And if we can do that, then we've eradicated the vast majority of Alzheimer's disease and virtually all of the, oops, that's 5 minutes. So I'm just going to steal 1 extra minute from Amanda and tell you this. So we have spent a lot of the last 20 years focusing on people in their late 70s and 80s who already have disease. We at Emory have initiated a very ambitious program now to target middle-aged individuals. And by middle-aged, I mean, that starts at my age plus 10, so when you're in middle 60s. Now, really, between about the ages of 50 and 70, when we think you're a couple of decades away from being at the highest risk, we want to identify people who are going to be at risk and find ways to predict if there is evidence of pathology, is that pathology going to manifest as disease in 5 years, 10 years, 15 years, or 20 years? And depending on where you are in your health span when that happens, then we will determine how much risk to accept in terms of treatments to prevent the disease. And that's something called the Emory Healthy Aging Study, with a subcomponent of it called the Emory Healthy Brain Study. And we expect to enroll about 100,000 individuals in the Healthy Aging Study and up to 5,000 individuals in the Healthy Brain Study to do exactly this. And it's a major task. It was made possible to get started with this by a transformative gift from very generous donors, and we have an obligation now to carry that forward for decades to come, and I expect to see big things from that project. So thank you very much. I apologize, Amanda, for running over.